Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study published in the Journal of Veterinary Internal Medicine in 2024, which explores the risk factors associated with sleep-disordered breathing in our canine companions. Sleep-disordered breathing, or SDB, is a condition that has gained increasing attention in veterinary medicine, particularly concerning certain breeds. In humans, sleep-disordered breathing is a significant health problem, encompassing conditions like obstructive sleep apnea, central sleep apnea, and sleep-related hypoventilation. The study we are discussing highlights that in brachycephalic dogs, those breeds with characteristically flattened faces, SDB often mirrors human obstructive sleep apnea. This manifests as hypopneas, which are partial blockages of airflow, and apneas, complete cessations of breathing, all stemming from an obstruction in the upper airways. We already know that brachycephalic obstructive airway syndrome, or BOAS, which results from the unique skull structure of these breeds, leads to varying degrees of upper airway obstruction. Beyond BOAS, other factors like airway swelling have been implicated in causing increased airflow resistance, even in dogs with more typically shaped heads. Owners of dogs suffering from breathing issues during sleep might observe signs such as their dog sleeping with their chin elevated or in a sitting position, snoring, experiencing apneic episodes during sleep, or even having difficulty sleeping at all. Veterinary researchers employ various methods to evaluate SDB in dogs, including comprehensive sleep studies called Polysomnography and a technique called whole-body barometric plethysmography. More recently, a portable neckband system has been successfully used to assess these breathing disturbances in a dog's familiar home environment. This neckband system, worn for a single night, provides data on the rate of obstructive SDB events. While we have some understanding of the risk factors for obstructive sleep apnea in humans, beyond the clear predisposition in brachycephalic breeds, there's been a lack of information on what other aspects might make dogs more susceptible to SDB. Interestingly, SDB has not been widely described in dogs with normally shaped heads. In the human realm, anatomical features reminiscent of those seen in brachycephalic dogs, such as a smaller upper airway coupled with a significant amount of soft tissue in that area, along with other differences in facial and upper airway anatomy, are known to increase the risk of obstructive sleep apnea. Furthermore, obesity is a primary risk factor for OSA in people, and weight loss is often an effective treatment. Age also plays a role in humans, with the prevalence of OSA generally increasing as individuals get older, although hormonal factors, particularly in women after menopause, can also influence this. Given these parallels and gaps in our knowledge about dogs, the objective of this study was to identify the risk factors for obstructive sleep-disordered breathing in our canine patients. The researchers hypothesized that beyond brachycephaly itself, an increasing severity of BOAS, increasing age, and increasing body weight would all predispose dogs to experiencing SDB. To investigate this, they conducted a prospective observational study involving a group of privately owned pet dogs, carefully selected to include both brachycephalic and normocephalic breeds. The study involved 63 adult pet dogs who underwent sleep recordings in their own homes. Of these dogs, 28 were brachycephalic, representing breeds such as French bulldogs, Cavalier King Charles Spaniels, pugs, and English bulldogs, while 35 dogs had more typical head shapes. The group included a mix of male and female dogs, both neutered and intact, with a median age of 5.8 years and a wide range of weights. Importantly, 46 of these dogs also attended a study visit where they underwent a physical examination and had their body condition score assessed using a 9-point scale. 12 of these dogs were classified as having excess weight, defined as a body condition score of over 5 out of 9. For the brachycephalic dogs that attended the study visit, the severity of their brachycephalic obstructive airway syndrome was graded. Based on this grading, they were categorized as either BOAS negative, showing no or mild signs, or BOAS-positive, exhibiting moderate or severe signs. To assess their breathing during sleep, each dog wore a portable neckband system for one night at home under the supervision of their owner. This system included a microphone to record tracheal sounds, an ambient microphone, and a gyroscope to track position and movement. The primary measurement obtained from these recordings was the Obstructive Respiratory Event Index, or OREI, which represents the number of obstructive apnea and hypopnea events per hour of monitoring. Additionally, the percentage of the recording time the dog spent snoring was manually scored. The results of the study provided some key insights into the factors influencing sleep-disordered breathing in dogs. When looking at the entire group of 63 dogs, brachycephaly emerged as the only statistically significant risk factor for a high OREI value. In fact, brachycephalic dogs had, on average, over 5 times higher OREI values compared to their normocephalic counterparts. When researchers focused on the subgroup of 46 dogs that attended a study visit, they identified both brachycephaly and excess weight, defined by a body condition score over 5 out of 9, as significant risk factors for a high OREI value. In this group, dogs with excess weight were over 3 times more likely to have a higher OREI. Furthermore, within the brachycephalic dogs that had a study visit, the severity of their BOAs played a crucial role. Dogs classified as BOAS-positive, meaning they had moderate or severe BOAS signs, were found to have a significantly higher risk of a high OREI value. Interestingly, in contrast to the initial hypothesis, increasing age was not found to be a significant risk factor for a high OREI value in this study. The owners also provided valuable information through questionnaires about their dog's sleeping habits and any signs of sleep-disordered breathing they had observed. The most commonly reported signs associated with SDB were restless sleep, snoring, sleeping in a sitting position, sleeping with a toy in their mouth, and apneic episodes during sleep. Dogs with an OREI value above 5, a threshold considered normal in adult humans, were more likely to exhibit these owner-perceived signs of SDB. Snoring was also significantly more prevalent in dogs with higher OREI values and in brachycephalic breeds in general. The median snore percentage was considerably higher in brachycephalic dogs compared to normocephalic dogs. The median OREI value across all dogs in the study was 1.4 events per hour. However, this varied significantly between the groups. Brachycephalic dogs had a median OREI of 3.8, while normocephalic dogs had a much lower median of 0.7. This clear difference underscores the strong link between skull conformation and sleep-disordered breathing. The discussion of these findings sheds light on several important aspects of sleep-disordered breathing in dogs. The study successfully utilized a portable neckband system to assess SDB in a non-invasive way within the dog's home environments, providing valuable data on the OREI. The confirmation that brachycephaly and excess weight are indeed risk factors for SDB aligns with observations in human obstructive sleep apnea. Moreover, the finding that increasing severity of BOAs elevates the risk of SDB in brachycephalic dogs provides a more nuanced understanding of the impact of this syndrome. The owner-perceived signs of disturbed breathing during sleep were generally less common in dogs with a low OREI value, suggesting that these observations can indeed be indicative of SDB. The researchers noted that restless sleep was more frequent in dogs with higher OREI values and in brachycephalic dogs, proposing that nighttime restlessness could be a sign of SDB in dogs, although other conditions like osteoarthritis or cognitive dysfunction could also contribute. Similarly, unusual sleeping positions, such as sleeping sitting up or with a toy in the mouth, were more often seen in dogs with higher OREI and in brachycephalic breeds, potentially representing an attempt to maintain better airflow. However, the study also pointed out that these positional behaviors are not exclusively linked to SDB and can be influenced by other factors or habits. Apneic episodes witnessed by owners were also more commonly reported in dogs with higher OREI and in brachycephalic dogs, further supporting the link between these factors and more severe sleep-disordered breathing. Snoring, particularly when it occurred most of the time or continuously, was also strongly associated with high OREI values and brachycephaly. However, the researchers highlighted that there were inconsistencies between owner-perceived snoring and objectively measured snoring, suggesting that owners may not always accurately recognize or report this sign, possibly due to considering it normal for brachycephalic breeds. The study's finding that brachycephalic dogs had significantly higher OREI values reinforces the established understanding that their unique anatomy predisposes them to upper airway obstruction during sleep. The novel finding that increasing BOAS severity further elevates this risk underscores the importance of managing BOAs in these breeds. The researchers drew parallels to human studies where anatomical features similar to those in brachycephalic dogs are associated with obstructive sleep apnea. While a considerable proportion of brachycephalic dogs in the study had OREI values above the human threshold for OSA, it's important to remember that this was not a random sample of the general dog population. Interestingly, the study identified sleep-disordered breathing in a normocephalic Norwich Terrier with an OREI value above 5, a novel finding according to the authors. They suggest this could be related to upper airway syndrome, a condition known in this breed that involves airway swelling and possibly a tendency towards brachycephaly in the breed's development. Despite the known association between Chiari-like malformation, a skull defect prevalent in many brachycephalic breeds, and central sleep apnea in humans, central apnea events were not observed in this study group. This supports the idea that the sleep-disordered breathing seen in these brachycephalic dogs is primarily obstructive in nature. The identification of excess weight as a risk factor for SDB in dogs echoes the strong link between obesity and obstructive sleep apnea in humans. While the exact mechanisms in dogs need further investigation, the researchers suggest parallels to how obesity can increase pharyngeal collapsibility due to mechanical and neuromuscular effects in humans, as well as anatomical changes like decreased lung volume and upper airway narrowing due to fat deposition, also seen in brachycephalic dogs. The lack of a significant association between aging and high OREI values in this study could be due to the limited sample size and the inclusion of many young brachycephalic dogs already affected by BOAS. In contrast to human studies, where OSA prevalence increases with age, the canine picture may be more complex, possibly due to the early onset and severity of BOAS in predisposed breeds. Similarly, neither gender nor neuter status were found to be significant risk factors for SDB in this study, differing somewhat from human findings where OSA is more prevalent in men. The researchers acknowledged some limitations of their study, including the neckband device size limitations, which prevented the inclusion of very small dogs, and the fact that not all dogs underwent a full study visit, meaning potential coexisting conditions affecting breathing could not be entirely ruled out. They also noted that the BOAS severity grading used may not perfectly capture the respiratory signs in all brachycephalic breeds beyond the most common ones like English and French bulldogs and pugs. In conclusion, this study provides valuable insights into the risk factors for sleep-disordered breathing in dogs. It reinforces that brachycephaly is a major predisposing factor, and importantly, it highlights that excess weight and increasing severity of BOAS also significantly increase the risk of obstructive SDB. The researchers emphasize that to improve breathing during sleep in dogs, maintaining a healthy weight is crucial, especially for brachycephalic breeds. Further research is needed to establish clear thresholds for normal and abnormal OREI values in dogs and to better understand the severity grading of SDB in this species. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.